Imagine waking up in the middle of the night, feeling a surge of nausea. You rush to the bathroom only to find yourself vomiting a dark, almost black substance. Panic sets in. What could it be? How serious is it? Stay with us as we uncover the alarming truth about black vomiting, its causes, symptoms, and what you need to do if it happens to you. Welcome to our channel, where we dive deep into medical mysteries and provide you with crucial health information. Today, we're tackling a topic that can be both frightening and life-threatening: black vomiting, medically known as hematemesis. Black vomiting is a condition where an individual expels dark-colored blood, often resembling coffee grounds. This ominous sign can indicate a severe underlying issue within the gastrointestinal tract. Now, you might be wondering, what could possibly cause this terrifying symptom? Let's break down some of the most common causes. First on our list is peptic ulcer disease. Ulcers in the stomach or the first part of the small intestine can bleed, leading to black vomit. These ulcers are often caused by long-term use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, or by an infection with the bacteria Helicobacter pylori. Next, we have esophageal varices. These are enlarged veins in the esophagus, often due to liver cirrhosis. When these varices rupture, they can cause significant and rapid bleeding, resulting in black vomit. Gastritis, or inflammation of the stomach lining, is another potential culprit. This condition can be caused by excessive alcohol consumption, prolonged NSAID use, or stress. When the stomach lining is inflamed, it can bleed, leading to black vomiting. A Mallory-Weiss tear is a less common cause, but it's important to mention. This is a tear in the mucous membrane where the esophagus meets the stomach, often caused by severe vomiting or retching. We can't forget about cancer. Tumors in the stomach or esophagus can also bleed, and unfortunately, the presence of black vomit can sometimes be an indicator of a malignant growth. Lastly, medications like NSAIDs and anticoagulants can cause or exacerbate bleeding in the gastrointestinal tract, leading to black vomiting. Black vomiting rarely occurs in isolation. It's often accompanied by other symptoms that can provide clues to the underlying cause. Common accompanying symptoms include abdominal pain, dizziness, or fainting. You might also notice pale or clammy skin and a rapid heartbeat, all signs of significant blood loss. Another important sign to watch for is blood in your stool. This can appear as tarry or black stools, indicating that the bleeding is coming from the upper gastrointestinal tract. So, what should you do if you or someone you know is experiencing black vomiting? Immediate medical attention is crucial, but let's delve into what you can expect in terms of diagnosis and treatment. To diagnose the cause of black vomiting, doctors often begin with an endoscopy. This procedure uses a flexible tube with a camera to view the upper GI tract and identify the source of bleeding. Blood tests are also essential. They can check for anemia, which indicates blood loss, and assess your clotting function to rule out any blood disorders. In some cases, imaging tests like CT scans or ultrasounds are used to get a detailed view of your internal organs and locate the bleeding. Once the cause is identified, treatment can begin. Stabilization is the first step, often involving IV fluids and blood transfusions if necessary. Medications play a crucial role. Proton pump inhibitors can reduce stomach acid, helping to manage ulcers, while antibiotics might be prescribed if an infection like Helicobacter pylori is present. Endoscopic therapy can directly address the source of bleeding, for example, banding varices or cauterizing ulcers. In severe cases where other treatments fail, surgery might be necessary to repair the damage and stop the bleeding. To illustrate the seriousness of black vomiting, let's share a real-life example. Meet John, a 45-year-old man who led a relatively healthy life until one night he experienced black vomiting. John had been taking NSAIDs for chronic pain for years. He never imagined that these seemingly harmless pills could lead to such a severe condition. Rushed to the hospital, doctors discovered that he had a bleeding peptic ulcer. Through prompt endoscopic therapy and medication, John recovered. His story is a stark reminder of how important it is to pay attention to the warning signs our bodies give us. Black vomiting is a medical emergency. If you or someone else experiences it, seek immediate medical care. Early intervention can make a significant difference in the outcome. Prevention is always better than cure. To reduce the risk of gastrointestinal bleeding, avoid excessive use of NSAIDs and alcohol. If you need pain relief, talk to your doctor about safer alternatives. If you have a history of ulcers or liver disease, regular checkups with your healthcare provider are crucial. They can monitor your condition and provide treatments to prevent complications. Black vomiting is a symptom that should never be ignored. Understanding its causes, symptoms, and treatment options can save lives. If you found this video informative, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to our channel for more crucial health information.